Dr. Kevin Kavanagh is a retired physician, and he is also the founder of a national, soon-to-be international organization, Health Watch USA. Good morning, Dr. K.
Good morning, Jack.
You said you came to Lexington, huh? You escaped Somerset. But I talked to Mr. Jeff Shepard this morning from London. He said they didn't get as much stuff down there as we did.
Yeah, I know. Well, that's just the weather reporting, as we well know. It's
Yeah.
it's not exactly a science. I know they think it is, but it's not.
Yeah. Well, a couple things I want to start out with here, and I don't think you and I have talked about this new vaccination for children. Can you address that? Talking about, 6 months to 5 years, little children.
Yes, and that has been proposed by the FDA. I think they've requested that Pfizer submit their data. This is for the really younger kids, and my understanding is that they're looking at a 2-dose vaccine, maybe 3 doses in the future. They're studying that. I think that they've got some results that look good. I'm not sure exactly what the data is because they haven't released that yet, but that's to be taken up sometime, I think, the later part of this month in order to determine whether or not it will be given an emergency approval for the real young kids. Now, the problem with the kids isn't so much that they're going to get sick or hospitalized as often as adults. They still can, and they will fill up the pediatric hospitals, but it's not as common. They do much better with the infection, but they can spread that virus to others, to their caregivers. In my family, we have 3 family units, 2 of which had Omicron come in from school-age children. One was in grade school, one was in high school, and then we had another where it was brought in with a child from daycare. So they do spread the virus to others, and at a time when your ICUs and hospitals are filled, that's not a good thing to be happening. We need to decrease the spread of the virus. So that's why I think they're going on with the vaccination.
Here's the question I have. If it is 10%, I think they said, of the adult dose, and the thing is, the difference between a 6-month-old and a 5-year-old in terms of just sheer mass is huge. And I just wonder about those dosages, because it would seem like there should be maybe a different dose as you get bigger. I assume they've taken that into account.
Well, they have, but it's not really based on weight or size. I mean, there's some medications that it is based on the mass of the body. In other words, the fat and the muscle. There's others where the medicine doesn't go into the fat. It's just based on lean weight. And then there's others, such as the vaccination, that's really based upon the immunological status of the child. Because when the child gets exposed to the infection, they're not necessarily exposed to a number of viruses that's 1/100th of that's exposed to the adults. The child may get the full exposure. And so they base it upon the immunological competency of the child. So it's a little bit different in dosage. It's not just bigger people need, bigger doses and smaller people need smaller doses.
By the way, happy anniversary.
Oh, thank you very much. Yes, this is Mark's going on our 3rd year. Our first show was actually February 4th, 2020 on the, I tell you, I thought we'd have a 2-week anniversary, not a 2-year. It's been a tough anniversary, Jack. Really tough.
What is the appropriate gift, I wonder, for a 2nd anniversary? I don't know.
I really don't know.
Yeah, okay, I didn't get you anything. How about this data from the University of Kentucky?
Well, that I think is a little bit distressing, and this is just their data that they release daily. On Thursday, they really hit a peak with 192 inpatients, 54 ICU patients, and 35 ventilator patients. And I went through some of their other data. For example, back in January 24th, they had 157 inpatients, 41 ICU, and 33 patients on the vent. And this is the Omicron variant by almost, I would say, 90% plus Omicron. And this is the reason why we said infectivity imposes just as much of a problem as a high case fatality rate, because as you get more people exposed to the virus, you of course get more people that have the potential of dying. And we are filling our hospitals with this, and this will again inhibit other people from being able to get good medical care for other conditions. If you come in with upset stomach or chest pain and you're wondering whether or not you have a heart attack, if you come in with a stroke, etc., you may have delayed care because everybody is just swamped with these patients. And as you stated the last program, some people may be waiting for a bed in the hospital for days. So it's not a good situation to be in. Other frontline services, including teachers, are pretty much in the same boat. Even if this virus was as lethal as the flu, which it is unfortunately much more lethal than the flu, but if it was just that and you have 20 times the cases, you will cripple our economy, inhibit the delivery of frontline services, and further risk lives. And so we really do need during these surges to follow public health advice, wear N95 masks, do home testing, and above all, get vaccinated.
Someone has texted in, how do they tell what variant you have? How do they know it's Omicron?
Well, you have to do sequencing, which is a more extensive test. I'm just saying that based upon sampling of what's been done in the United States. We are now primarily an Omicron pandemic. Hopefully we'll get to a point someday, as with a few other countries, where we're sampling a large majority of our infections. But right now, we're not sampling everyone.
What about this stealth thing, this variant of the variant?
Well, that's a little bit distressing. The data that we're seeing out of Denmark is encouraging from the fact that it doesn't appear to be more lethal or have a higher case fatality rate or cause more severe infections. But newly published data shows that it's at least 50% more transmissible, and unfortunately it also appears to have a propensity of escaping the vaccines and the boosters. Not completely escaping, but some of the data shows they're between maybe 2.5 to 3.5 times as more infectious in those that actually have been vaccinated. And that's not a good thing. So it's starting to escape vaccinations and boosters. However, remember, even if you're 3.5 times more infectious if you're boosted, you've got a very low infection rate to begin with. So you're still not going to be spreading that virus nearly as much as if you're unvaccinated. And that's the same thing as far as getting into the hospital or getting into the ICU or dying. Your chances are much, much better if you're newly vaccinated or if you have a booster. And there is a big difference with Omicron between being vaccinated less than 6 months or greater than 6 months. So right now the recommendations are if you've been vaccinated greater than 5 months, you should get boosted. The same should be true even if you've had an infection. Again, 6 months appears to be the magical time period that if you've got an infection, you're not going to have much immunity. And of course, if you had a mild infection, you may not have had much immunity being produced from the get-go. So even if you're infected in the past, you want to go on ahead and get a vaccination and just view that as a booster. This virus is dangerous and everybody needs to have their immunity up as high as possible.
All right, with the Winter Olympics, actually it's set to officially begin today or tonight. They've already had events, but anyway, thousands of athletes entering what Beijing officials are calling a closed-loop system. That means athletes, coaches, support staff are strictly cut off from the outside world to try to prevent the spread of coronavirus, and they're tested every day. But there have been nearly 300 confirmed cases among Olympic arrivals already. 102 of them are athletes and team officials. And from the United States, that includes four-time Olympian Lana Myers-Taylor, Team USA's top medal hope in bobsled, and her husband, Nick Taylor, an alternate on the men's bobsled team. So do you pay attention to the Winter Olympics? And I guess my question is, why have they had so many infections when they have the so-called closed loop?
Well, I think that a lot of the athletes were in what we call an incubation period. In other words, it may take several days for that virus to start reproducing enough that the test will detect it or that a person becomes infectious. So if you get a test right before an event, let's say 10, 15 minutes before the event, that is a good level of protection. Not 100%, but a good level of protection as far as people being okay for that event. In other words, that day or within a few hours. But then if you go 2 to 3 days out, that person can still become infectious. But one of the things I think people really need to understand is that when people are greeted by individuals in hazmat suits as they're entering that country, maybe this isn't just a political scheme in the United States, that this is actually a worldwide pandemic. Austria, they've introduced vaccine mandates. As you know, Australia had the problem with the tennis player, wouldn't let him in or playing unless they were vaccinated. This is worldwide policy.
And we have some text for you this morning. Doctor, ask the doctor about his thoughts on Ivermectin. Japan has now said that is their go-to treatment, with 80% of cases recovering quickly, including those that are hospitalized and on ventilators. They are considering giving Ivermectin to everyone in Japan. First of all, is that true?
I don't know. I have not heard that. I would have to really review that research and report back. I would think if it was absolutely true, it would be all over the news media at this point. And I'd be surprised. But we could talk about that Monday morning.
Okay, fair enough. Here's another one that says, can you ask Dr. K what happens 6 months after my booster? What should I do then?
Well, I'll be honest with you. I had my booster right before my surgery, and I'm at the 6 month, really at the 6 month anniversary also. And I've been asking that same question. It does look like these shots tend to wane, and at 6 months you are at a higher risk than what you probably would want to be. So right now I am just holding and being very careful. Of course, I'm at a high risk category also. So when I tell people what I do, you need to remember I'm elderly, have recent cancer treatment, so I'm very, very cautious. I am hoping they will get the specific vaccine out for Omicron, and that I will be first in line to get. I'm a little concerned personally that if I get the booster now and they come out with this vaccine in 1 or 2 months, do I want to then very quickly get that on top of the booster? Who knows? I don't think anybody really knows. There have been some research on a 4th dose that came out of Israel, and for people who are at high risk, they are currently recommending a 4th dose of Pfizer, or they say you can be considered. Ask your doctor, but as far as the general public, they haven't come out yet and said everybody should get one. In any event, the 4th dose doesn't appear to give you as much of a boost as you got with the 3rd dose booster. So at some point, we need to get a better formulated vaccine. Remember, this vaccine was formulated for the original wild-type Wuhan virus, and you want to get a booster that's for your current variant or at least a different variant, so your immunological response will broaden and you'll be protected by more variants in the future. So right now, personally, I'm holding, but may get a 4th dose if it looks like the vaccine that is coming about for Omicron is going to be delayed in a long period of time. So I don't know the answer to that.
Okay. Earlier in the show, you made reference to the flu, which was just almost non-existent last year, but it is back this year. And I'm assuming that you are suggesting that folks get the flu vaccine.
Definitely. I've gotten my flu vaccine. And of course, this year it's back because people aren't wearing masks as much. They're not social distancing, etc. So now the flu is also able to spread. And what you don't want to be is one of those very unlucky, but luckily rare individuals that get both of these at the same time.
And for those of you who don't know, if you're over 65, because Dr. K and I do, there is a high dose version of that flu vaccine. Always good to talk to you. Have a great weekend, and we'll talk to you on Monday. Thank you.
Thank you, sir.